Hi everyone, welcome back to I Love Pharmacology. In this session, let us learn about a very important topic, that is drug of choice in the treatment of hypertension. So here are four important conditions to learn about. Myself, Dr. Padmanabha TS, let us learn about which are the drugs which are useful as drug of choice in hypertensive conditions. So according to the JNC criteria, so the drug of choice in case of hypertension is. So how to remember? In case of hypertension, you need to remember T. So whenever you write a hypertension, so HTN, so it is the T, tension. So it is the thiazide diuretics which are the drug of choice in the hypertension. So hypertension में tension हो जाता है, so T for thiazides. So next, coming to the in case of hypertensive emergency. So please remember, in case of hypertensive emergency, next best drug that will be given is the N. N stands for nitroprusside. But some of the books also mentions the other drug, that is emergency C. What will happen? C emergency. So you can give calcium channel blocker also. So next, coming to the gestational hypertension. So in gestational hypertension, so क्या होता है gestational hypertension? So it occurs in pregnancy. So who will be affected more? It is the mother affected more. So that's why you need to give a methyl dopa. So who is affected? Mother will be affected here. So mother will be affected. That's why you are giving the methyl dopa. Since gestational hypertension, you do some of the laboratory investigations also. So some of the the standard textbook will give a drug of choice as a labetalol that has to be given orally. So next, coming to the hypertensive emergencies during pregnancy. So in hypertensive emergencies, so what you need to do, especially in case of pregnancy, it is the high priorities. So you need to give high priority. That means high, you need to give hydralazine. So in some of the textbook, again it mentions it as a labetalol, but it is through intravenous because of emergency. So in case of hypertensive emergency, let us discuss. So in case of hypertension, so if it is a hypertension case, normal, so what you need to give is the thiazide group of diuretics. So you need to give a thiazides is a drug of choice. If the patient is having hypertensive emergency, so next best drug will be the nitroprusside. So it is nitroprusside. And some of the books will also mention the other drugs which can be a drug of choice in case of hypertensive emergency, that is the emergency. So it ends with C. So calcium channel blocker can be a alternative drug of choice. So which is the drug of choice in case of gestational hypertension? So gestation means it occurs in the mother. So M for methyl dopa. And since you will be doing lot of laboratory investigations, some of the book also mentions labetalol is the drug of choice. So which will be the drug of choice in case of hypertensive emergency, in case of pregnancy. So hypertension in pregnancy is a high priority. So you will be using the hydralazine. Again, since you will be doing a lot of lab investigations here, you can also give labetalol according to the standard textbook, but it is given through IV route. So in one word, if you want to remember the every drug of choice under hypertension, is just you need to remember a 3-letter word, that is HTN. So for hypertension, you give drug of choices for hypertension. The drug of choices thiazides. And for hypertensive emergency, the drug of choice is nitroprusside. So since emergency CCC, so calcium channel blocker can also be given in hypertensive emergency. In case of the high priority pregnancy, that means if the hypertensive emergency in pregnancy, you give hydralazine. And also here, since you will be doing a lot of lab investigations, you can go for labetalol through IV route in case of hypertensive emergency. But if it is a gestational hypertension, since it occurs in the mother, so it is methyl dopa will be the drug of choice, methyl dopa. Again, here you can also give a labetalol according to the standard textbook through oral route. So please remember, do not forget this. So it is thiazides. So do not forget. So we have thiazide group of drugs, nitroprusside, hydralazine, as well as the methyl dopa. So if you find this video useful to you in learning the concepts with respect to the drug of choice in hypertension, please do not forget to share and hit the like button for more updates on pharmacology. So although it looks very difficult, having a simple mnemonic as well as revising frequently, you'll be able to recall it nicely without any tension. So some of the mnemonics should be made. The mnemonic should not be too much complicated. It should relate to the concept so that you can learn it very quickly and easily. Thank you.